Ladies and gentlemen, as we present these awards, it is so heartwarming that each one of you are playing such an important role toward strengthening the healthcare sector. As we talk about healthcare sector, it covers the entire spectrum of curative, preventive and promotive healthcare. And towards that, in this August gathering, as we are going to be recognizing and appreciating, we are going to be recognizing individuals and organizations who are not only engaged in good service delivery of healthcare, but also we have organizations who are dealing with drugs and diagnostics, dealing with the data and digital, with vector control. We recognize your new initiatives, your technologies, your work, your care and compassion which you have been extending to the patients and working towards creating a healthy India. स्वस्थ भारत ही एक समृद्ध भारत की नींव रख सकता है. उसकी तरफ आपके योगदान को यहाँ पर सम्मानित किया जाएगा. Ladies and gentlemen, just a little word about Asia Today also. This is a research and a media organization. And they have a very dedicated and a professional team. They have been working in the areas of education, in also in the healthcare sector, as we present these healthcare awards today. And they have a dedicated team who in fact have, on the basis of a lot of search and research, and also working closely with various organizations, they chalk out the winners of the day. As I said that we are going to be starting with the awards shortly. Before that, we would like to delve into some of the key challenges being faced by the healthcare sector, and towards that we have a half an hour summit wherein we are going to be covering various topics, latest in treating neurological disability, cancer and cardiac diseases, and then also the kidney diseases. So we are going to be talking about some of the challenges which our healthcare workers face while working in the rural area and taking these best of the facilities to the rural areas. COVID-19 pandemic, I think इसके बारे में हम सभी इससे निकले हैं. COVID-19 pandemic का जो impact हुआ है बच्चों पर, that stands as a major concern, especially on their health. That we would like to discuss here. We discuss public health crisis, how do we address it, the impact of air pollution on our health. This last which we are going to be discussing on, which concerns each one of you, are Indian doctors in a safe environment while working. We have seen, especially during the pandemic, when people are not getting the services and they बहुत एक anger रहा है लोगों में, और उस समय डॉक्टर्स को लेकर या हमारे हेल्थ केयर वर्कर्स को लेकर, नर्सेस को लेकर, और कभी कभी डॉक्टर्स को अपनी आवाज़ आगे रखने के लिए एक स्ट्राइक भी करनी पड़ी है. सो वी आर गोइंग टू बी टॉकिंग अबाउट आवर इंडियन डॉक्टर्स वर्किंग इन अ सेफ एनवायरनमेंट. So all this we take this forward, and I would like to invite our eminent speakers. May I request Mr. Jyoti Kalash, the Special Chief Secretary and Resident Commissioner, Government of Nagaland. Sir, may I request you to please join us as our esteemed panelists. Dr. Vijaya Bhaskaran S., the Executive Director, Kaveri Hospitals, Bangalore. Dr. Mohana Rao Pati Bandala, Chief Neurosurgeon, Pati Bandala Narayana Swami Neurosciences. Our next panelist, Dr. Dilip Kumar Pahadi, Chairman, Medical Institute of Kidney Diseases. Dr. Kumar Rajesh Ranjan, Consultant Urologist. Dr. Rajesh Vunamatla, Gastroenterologist. Dr. M.M.A. Faridi, Principal, Dean and CMS of Eros, Lucknow Medical College. Dr. Z. Azad, the Managing Director of Midas Hospital, Neuro and Multi-Speciality Hospital. I would also like to now invite the moderator of the session, inviting Ms. Shobha Rana, a leading
live show host, and holistic wellness and life coach.
I would like to welcome my panel here on stage. And our healthcare sector is in very, very able hands, seeing you go all over here. So, gentlemen, I would like to start the discussion. The first topic that we are discussing over here is let's talk about the pandemic, COVID-19 situation. We all know how it went, and it completely blew out of the proportions. There was a lot of load on the healthcare sector, and all of you were under tremendous pressure 24/7. So how has it been for you? And like Vimi asked that, what are the impact do you think those are long lasting for us and even for the younger generation, the kids who have been locked inside their homes through the entire year, and now that things are slowly opening up, what do you think the mental state of these kids, and even for us, how is it going to be, and what does the road ahead look like to you? So I would like to firstly prompt the question to Dr. Vijay Bhaskaran here. I would request you to pick up the mic and, lead the talk for us.
When compared with the Spike 1 and now Spike 2, Spike 3, like that is going on, I thank the government of India on behalf of the entire healthcare fraternity because vaccination has done wonders. Definitely in the coming days, whomever got vaccinated, either single or double dose, definitely they will be safe. That is one. Second one, how we are going to handle the things when we are following all the COVID protocol coupled with whatever the healthcare workers are telling, definitely we can avoid further spread. As far as kids is concerned, clinically there are so many advantages. Definitely the immune system and all can help them in the coming days. Definitely I think we should not worry but for the safety.
Thank you for that answer. And, the danger is not yet lifted, as they are saying. So I would like to prompt this question to Dr. Kumar, that what do you think, is there a chance of another wave here, or are we finally safe? How is it looking?
Yes, there is a chance of third wave, but we are taking too much of precautions, and we are prepared for the third wave because the first time when it came, we are not able to understand what is happening. We thought that it may go in 2 or 3 weeks after lockdown. But the second wave was so horrible. We never thought that it was going to so much devastation and creating a horror for all of us, where simultaneously from north to south, east to west, every home was affected. Many people died. And because no state can create so much infrastructure, so we were badly damaged. But now I think we have created infrastructure and we are more prepared now.
So Dr. Rajesh, you think that even if there is, God forbid, another wave, we are future ready for such a public healthcare crisis?
No state can be so much prepared, so it can be so much devastating. But now we are better prepared for it, as I think.
Coming from one pandemic to another, because this air pollution situation, especially in the northern part of the country, is, seemingly becoming large every year, and the numbers are going high on the AQI index, and it's becoming a huge area of concern to an extent that from the last few years, the schools are being shut, the people are not going to their offices, and, it's been very scary here. So what do you think is the impact of this increasing air pollution in the northern part of the country, and how is it going to impact or get impacted in the years to come? I would like to prompt this question to Dr. Faridi here.
Thank you so much. In fact, I was told to talk about impact on children. I'm a pediatrician. But anyway, that concerns with everybody. Where we left, I like to add to my the esteemed panelists here and the dear friends in the audience. We must not forget about the impact on children. And we are not talking much about it, except that we are preparing for the curative care of the pediatric COVID. We have not been talking about what has actually happened to pediatric age group. Right from, in fact, we pediatricians are concerned with the epidemic of communicable diseases like diphtheria and pertussis, because for the last 2 years, no immunization is going on. And if you remember, the Honorable Prime Minister said the stop TB by 2025, and the children make a large group of reservoir of TB infection. And nothing being done because of everything busy with the COVID. So we know that apart and when the anchor was, the compere was telling about the children not going out, the growth and development goes together. And the development, you need to have the children to, interact with each other. And these children are actually homebound all the time. So the development is grossly being affected. The speech is going to be affected. So there are large amount of them actually being, the nutrition, the immunization, and all this. Coming to your question, yes, this is second to be the second non-communicable epidemic because of the pollution which is there. And every disease can be attributed to the pollution which is taking place. And we are talking to n number of things in Delhi. Since I belong to Delhi, we read all about it. The parali burning, and then the vehicle, and then all kinds of suggestion being made that you at least stop one day, don't drive your vehicle and all that. But little bit, everything ultimately adds up to what's actually going around. Construction is being going around, and we know now the Hon'ble Prime Minister has inaugurated the Jewar, one of the largest airport, and the construction will go up to 2024, and there'll be a lot of pollution there. So, we have to, the industrial development, the manpower development is actually associated with the pollution. So the only thing is that how we can, everybody of us actually have to chip in, and whatever we can do at our level. But yes, please take it that the pollution is not only affecting us adult children, but also the child in the womb. The fetus also been affected because of the pollution. So we have to be all careful, not only respiratory diseases, but in fact it's been said to be all metabolic disorders because of this pollution.
Very rightly said, sir. And in fact, we are getting stuck in this whole hamster cycle, which we are not able to break out of. Is it the right governance? Is it our responsible attitude? Or is it the industrial rise? What exactly is the reason for this, and how these reasons are, aggregating together to worsen the situation every single year? But nevertheless, this is the situation we have at hand, and we're in the hands of the able doctors such as yourselves taking care of us. I would now like to move on to Dr. Dilip here on the panel with us. And the next question I would like to prompt to you. So, sir, the respiratory health of the whole country, in fact, and more for the northern India is completely on a toss, This AQI index that's been discussed for years now, it's completely getting hazardous and all. So what are the top primary respiratory precautions or certain sort of regime or exercises, or what would you like to suggest to our viewers here that they can incorporate this, and from a medical perspective, this is going to help them for a better lung health or respiratory health?
I think if you have a pollutant like 2.5 micrometer, diameter particles in the air, no amount of respiratory exercise or physiotherapy going to help you. So, you have to restrict the polluted air from entering your lungs. You can use a filter in your home or the office you are working, but if you are going outside, then you can't do anything. Some sort of a physiotherapy or exhalation physiotherapy you can try, but that does not really going to help you, because air we inhale, if it is a small air particles, that will enter into the lung alveoli, and you cannot exhale as such. The only, I think it should be this, as the science is evolving, I think we must, and the planners must look into it. So like in Delhi, in India, Delhi is a center, there is no sea around, so you should rather decongest Delhi actually. If you are a planner, I will say you decongest. Why there is industry or something close to Delhi? There should not be. It should be close to anywhere sea. We have a huge sea areas. There pollution will be less because close to sea. And then decongest Delhi actually. And then other thing is possibly once the science evolves, the electricity, cars and everything comes, then possibly it will come down.
Rightly said, sir. Hearing all of you here on the panel, the thing that is coming up again and again is the amount and the magnitude of the situation that is going out of our hands. And, now the doctors are also coming out and admitting to it openly that yes, situations, are on the rise and they are going out of the hands. So, this whole environment, for the working mechanism of the healthcare sector, the doctors and the healthcare workers working in it, it's becoming extremely pressurizing for them, and it's also becoming a little, do you think it's unsafe, or how do you think of the present situation and the load that the doctors have and the kind of impact that they have to face from the people at large? So I would like to prompt this question to Dr. Zaw Ali Khan. I would like you to take this question up next now. There are a few, names getting edited in the end.
So, regarding the pressure on the healthcare system, I feel that the pandemic has done its part in making us realize we need to strengthen it further. And doctor to patient ratio that isn't skewed just in India but all over the world. In India, of course, it was highlighted quite a lot in the second wave. But I think there are ways of overcoming it in this age, because we have technologies that can augment the abilities of doctors. Doctors don't have to do as much of the footwork as they had to do traditionally. So they can rely more on some of these digital technologies. They can also, not just doctors, other healthcare workers as well, can manage more number of patients with lesser effort if they are to harness digital tools properly.
Yes, sir, sure.
If you 100 years back, there is a Spanish flu. We know there are 3 peaks. First phase, second phase, and third phase. So 100 years later, it is almost the virus replicates. It has got an intensity, and then they develop, more infective, and then eventually they lose potential. That's the natural course of any viral disease. But here, the healthcare sector, not the doctors, clinician working at the field, but the research benches, we produce vaccines at a faster rate. Normally vaccines production takes around 10 to 12 years. Here, within a year, we produce the vaccine. So that is one of the faster rate. Few medicines, oral medicines has come up, monoclonal antibody has come up. So now, even for looking for the third phase, we are well prepared, because you have now antibodies, you have now antiviral drugs, we have now vaccines. So possibly, third phase may not come actually, truly sense. So there's maybe localized. Okay.
Hopefully that is true, sir, and hopefully that's how it go.
Right, but I think even though COVID-19 is now in our rearview mirror, hopefully, but there is always a possibility of newer, endemics and epidemics coming.
Right.
So that's why our healthcare system needs to be prepared, and it has to be easily scalable when the need comes.
Right. I think the pandemic, this one came from nowhere and shook us all into reality, and to see the grave realities of the real state and situation that lies at the state level, at the country level. And coming from the state to the rural areas now, I would like to talk to you, Jyoti Kalashji. I would like to take your input that what do you think are the biggest healthcare challenges in the rural areas, and how do you think we can, design policies or request for certain amendments in the current healthcare policy so that it also becomes more inclusive for these people in the rural areas?
Yes, as an administrator, I see the entire problem in a different perspective, because rural administration, urban administration, we are in the forefront. In this pandemic, in the wave first, you would have noticed that the impact in the rural areas was very little. But in wave 2, we had seen the impact in the rural areas. And that was a major cause of concern for administration. In the rural areas, I can safely say that immunity level is high. People can withstand the adversities of nature. Whereas in urban areas, the general immunity is less. We fall prey to various diseases, whereas in rural areas, still, there are cases, of course, but When we talk about the statistics, and in physical terms also, we don't find such diseases in rural areas. Of course, there are unreported cases. There are also heart attacks. There are also, various diseases, but many cases are unreported in rural areas. Infrastructure facilities are very poor in rural areas still. But the immunity, which I am focusing, is pretty high. We could withstand, we could face the pandemic in rural areas. Deaths were there. But again, if you compare rural-urban population, there were less deaths. Question is why? In spite of little infrastructure facilities in rural areas, people have survived. So we must go back to the history part of it. In rural areas still, people are facing sunlight, they get vitamins, proteins, everything. Their eating habit is different. They're not into junk food. Our lifestyle in rural areas is very different from the urban areas. So in urban areas, there are so many causative factors which has weakened our immune system. And that's why we fell prey to this pandemic. There's so many persons who died, especially in second wave. Everybody has seen. Deaths, the way deaths have happened in towns, in cities, we were completely shocked. We have infrastructure facilities in urban areas, but we were not able to give the services to each and every one. We were not fully prepared. Rural areas infrastructure facilities are very minimum, but now because of the awareness, because of the various campaigns by the NGOs, by the government of India, by the state government, the several guidelines, we started following. And now we are in a much better position. We could be able to control this pandemic. Still, say Germany, Russia, China, US, France, they are reeling under wave 5. Yesterday I was watching news. There you have also the rural areas, but the impact was very little. So the point I'm hinting at here is that the immunity level we need to improve. How you improve, it all depends on the individual. We must improve our immunity and then we will be able to fight against the pandemic. Therefore, I would like to say that our infrastructure focus, what the government of India is doing under various schemes, we are focusing on improving the infrastructure facilities, not only in the urban centers or semi-urban centers, but also in rural areas. And we are now much better equipped to deal with the situation. Thank you.
Thank you, sir. So the situation is improving from better, and it's for the good, of course. And about the immunity point that you raised, sir, so Ministry of Ayush also has issued various guidelines telling us how to build immunity and how to strengthen it. So I hope people follow those guidelines and we are able to, become a more healthier, more immune nation. Sir, would you like to add something to that?
I think one of the factors, I fully agree with him. And then one of the factors is the drinking water. When then you are not drinking a filter or mineral water in the villages. Your routine water which contains a lot of germs, and then people develop immunity to all these germs, as well as immunity to all the viral infections they have. So they have already inbuilt immunity there. And in cities, if you have to compete with the rural people, it's said they correct that rural people have got less COVID virus because they are already immune to a lot of gut bacteria as well as viral illness by influenza, parainfluenza viruses.
So the cushioned lives of the cities are making us less immune, and they're contributing to us catching the diseases more often than the rural areas.
I'd also like to add an anecdote to what Sir said. My immunology professor used to say this, even though I'm sitting in a 5-star saying this, but that's the irony, but he said that never eat in a 5-star, always go for the street side food, the taste would be better and you'd get free vaccination as well.
Yeah, that's one perspective to look at it. I would now come to Dr. Rajesh Munnamatla, who is sitting next to me. Dr. Rajesh, what are your thoughts on how prepared are we if, God forbid, there is another wave or there is another crisis coming onto the country or world at large?
Yeah, first of all, good evening, everyone. I think we have learnt a lot of lessons from the second wave, and we are very well prepared now. And the government of India has done an excellent job regarding the speed of vaccination, which all the countries all over the world were surprised. And that is one of the important aspect in, I don't know about the prevention, but at least control we can see. We are very well prepared now regarding the infrastructure, regarding the vaccination, if at all any third wave comes, they projected that pediatric age group is the one which will be more affected in the third wave. So regarding the preparation for the pediatric hospitals and all, and in fact everyone is looking forward for the third wave to treat.
Looking forward.
Forward, yeah.
I like to add what Dr.
Yeah.
Sahab has said. In fact, the disease was new, as we all know. Disease was evolving. We didn't know about how to treat. We didn't know what is the mechanism, what is the etiology, exactly what is actually happening, what is pathology of the disease, how the disease actually pathogenesis is taking place. And above all, the health workers themselves were so afraid of, the administrators were afraid of. We didn't know how to do it. Should we do isolation? We didn't have enough number of PPE and all those things. So the first which has happened is that now the confidence of the healthcare workers is that they can manage. So now they are able to go near the patient, because we have seen the first-hand information of the first phase and the second wave. And in the process, we developed in our institution some gadgets by which our exposure to the patient decreased. You know, the Government of India recommendation was that more than 55 years old faculty will not go to the COVID ward. And they have got the essence of the all knowledge and wisdom and skills, and they are being kept away. So we developed something so that they can also become the part of the management. So the first thing happened is that the healthcare manpower is actually more confident. The fear factor has gone away. They are not going near the patient. They are doing intubation also because of the fear of aerosols. So they were not actually touching. They were not doing intubations and all that. Luckily, the first phase was not that serious. Second phase could have been much worse if the healthcare workers would not have been, so powerfully empowered. So that's one thing. The second thing is the government actually stood rock bottom behind us. They gave us a lot of support to us. In fact, the Hon'ble Prime Minister, if you remember, 16 January was the first day of immunization. They said all the principals, the deans of the colleges will mandatorily take the vaccine on that day. I took the vaccine that day. So that's the second part. The third was the development of the infrastructure. Although the number of ventilators suddenly increased, but there was nobody to run them. So that inherent difficulty was there. So the government came out with a beautiful idea of training them. So in-service training was organized. And this training is still going on. So all these things together actually make us more prepared. So not only the infrastructure, but the zeal, our own willingness to do it. And the third thing is many cocktails were available that time, Give this, as somebody talked about the monoclonal antibodies, somebody talks about the plasma therapy, and we all know that. They were all individual, benefits or not benefits. There was no hardcore evidence, medical evidence available. And even today is not available. In fact, none of these drugs are going to help. So still we don't know which drug will be useful. And yes, the vaccination is one. And very wonderfully said, vaccine takes about 3 to 4 years nowadays, but we could do it in just a few months. But we don't know with a rider there. Many vaccines are actually mRNA vaccines. The vaccines are done in a way which have never been used in human. So I'm not putting any fear factor. I took 2 vaccines, but we don't know long-term effect. Therefore, we are worried about immunizing our children. Should we immunize them or we don't invite them? That's another difficulty with us, how we are going to deal with them. So many uncertainties is still there. Molecular antibodies, the drugs. Only 2 days ago, the Central Drug Research Institute, which is in Lucknow, the CDRI conducted during the pandemic a study on the anti-COVID viral disease drug. And that drug has been now published. Omifanovir was used, and this was found useful in mild disease and asymptomatic disease. It was found useful, not in serious disease. In fact, serious disease could not be tested. So also the pregnant women, we don't know. Breastfeeding women, we don't know should we give vaccine or not. So all is still, many areas is still unexplored. But as Dr. Saab said, we are prepared to look for the third wave. God forbid, whatever the signs are there, we are not expecting such a serious wave of the vaccine. But if it's there, we are prepared. Thank you.
Thank you for assuring hope, and that is what we need in today's time. And
the preparedness is in such a way that general public is asking, will there be any third wave? But hospitals are asking, when is the third wave?
that's one way to look at it, and that's a very positive perspective to look at it. And thank you for reassuring hope to everyone here and whoever is going to watch this video, because this is something that we need to be more vocalized. This is something that we need to tell our people to believe in this system, to believe in our able doctors. And it is such heartwarming to know that we are prepared, and things from here, hopefully they don't go wrong. But if at all, I think bravery of our health workers and everybody, in fact, working in the health sector has helped us to survive these two waves. And if at all there is a future calamity waiting for us, as you have assured us, thank you for giving those positive doses of information and hope to all of us. Now, I would like to once again move on to Dr. Mohanna here. Dr. Mohanna, I would like to ask you that in the development of the neurosciences, the latest innovation and technology coming up there, since you represent a neuro institute, what are the latest advancements there, and what are the challenges that you face, and how technology is enabling us to cope up with those challenges?
Good evening to everyone. Actually, COVID itself brought the stroke into a new perspective in the COVID. Like a stroke is one of the disease. Previously, we used to do only in the older people or 40 plus. But in the COVID, we saw almost every patient, or 30% of the total patients have the stroke. And recently, from 2016 onwards, we have the gadgets like mechanical thrombectomy and stent reverse, which were not there before. After 1996, 1996, we have a thrombolytic, and after that, in 2016, we have the first weapon in our armamentarium, which is like a mechanical thrombectomy. So, with the coagulability, there is a blood clot in the brain blood vessels, and we are able to remove those if the patient comes within 24 hours, and we are making them good. Our institute is one of the premier institute which has all the gadgets available around the globe at this moment, and we gave rebirth to so many stroke people who came here with hypercoagulability of the COVID state. And another thing is we have the infrastructure also needs to be empowered. I have seen I'm not condemning anyone here, but what I saw was there is a lot of technology, but the people are not well versed with the technology. I'm not commenting on anything, but having technology is one thing, and having the technician, the person should learn about the technology, which was lacking in most of the times, most of the places where I saw. In 2016, in America and everywhere, we got the mechanical thrombectomy. Here, only in big cities we are seeing it, and very rare in the, I came from Guntur, that is one of the second grade cities, where the mechanical thrombectomy is still one person is doing. So it's like still, it's a population of around 60-70 lakhs. So, and around like a few millions are in that area, but only 1 or 2 people are doing. So the technology is there, but the technical team also needs to be worked on that.
Right, sir. And, with this information, I'd like to come back to Jyoti ji here again, and I will take your perspective on how you think technology can enable or strengthen the healthcare sector in the rural areas. Let's come back to that topic that we just discussed, and let's see how technology can impact this.
No, technology has a very big role because the latest technology, the state-of-art technology in health sector, if it is introduced in the rural sector, it will take care of various problems which rural folks facing. Because first thing is that they don't know what kind of ailment they have. We still have large rural population which are uneducated, totally illiterate. They know only fever, some measles. But what is that, the impact of COVID-19 on them? They will not be able to explain. It is the duty of the doctor to find out and diagnose what kind of ailment the person has, whether he has the symptoms of COVID-19 or some other disease. So here, the introduction of technology, all the latest technology in the rural areas, routed through primary healthcare units, is very important. The visit of specialized doctors to the rural areas with the help of district administration is very important. Still, we have a very small villages and some big villages are there. But if you see the visits of specialists in rural areas, you'll be shocked. Sorry to say that many doctors I have seen, they avoid going to rural areas. It's a fact. But the dedicated doctors, they go everywhere. Whether they are facing difficulties in staying over there, they manage it. Now you have the telemedicine, you have video calling, you can consult doctor over phone and get yourself treated. So things are happening. It's not that, of course there was a time when these facilities were not there. But at least today in this world, if the visit takes place to the extreme rural population they're touching, the doctor will be able to examine the patient and can have a video call with his superiors, take the advice and prescribe the medicine. So all these things are part of the new technology. So technology has a big role to play in rural areas, and we must go ahead in a very, very aggressive manner. This is what I want to say.
Technology, sir, definitely, is going to help the situation, and, like you said, it can be one of the proposed solutions. But then what we have to again discuss is the affordability of this technology, especially for the people in the rural areas.
As far as the affordability is concerned, see, Government of India is running so many programs under various schemes. So people can take the benefit under those schemes. Now you have the healthcare at the doorstep of the population. It was not earlier. The nodal officer, whether is a chief medical officer or the district medical officer or the medical superintendent, so the government hospital has already set up a machinery. There is a nominated officer and the specialized team, when it visits district, they are in touch, they coordinate. They, the primary healthcare unit, they identify such target population, and then the visits do take place. So, affordability is not a big thing. There are so many free medical camps. You have the medical vans going at the doorstep of the rural population, and you have the treatment, medical attention given there. If there is a requirement to bring that patient to a hospital, a specialized hospital, there is a service available, and it's free of cost. There are so many NGOs which are working in that direction. So things have changed a lot. And this government, under the present leadership of our Honorable Prime Minister, the special focus is on rural population. We have taken care of urban population, semi-urban population, but the focus has also been shifted to rural population because they are part and parcel of our society. So this is it.
Please,
30
sir,
seconds.
please.
30 seconds.
No, please.
Just carrying what the sir has said, the technology, when we talk about, you say it will be very costly, who will run it, how we will run it. I'll give you an example that what we did at Eros Medical College during this COVID situation. Many patients were actually doing home isolation. And there was no mechanism, foolproof, so that when they get really sick, they should be shifted. So that means somebody should be there to monitor them. And there was nobody to monitor because the entire family was sick. So that time we developed a technology that we gave them the blood pressure machine and SpO2 measuring machine, and we developed a small software. Entire data was being projected to our college, and a dedicated team was sitting there of our junior doctors, and the SpO2 and then their blood pressure was coming here automatically. Nothing to be done. Nobody was actually feeding it. Same thing we use in our place also, real-time depiction of all the investigations, ABG reports, X-ray, MRI, everything. You do MRI in the department, and the image comes directly to the screen where you are sitting. And sitting away from the patient so that there's no exposure, you're not wearing the PP all the time. And this technology we have given to Government of India as a token of help to the nation, and this has been established in Lady Hardy Medical College. So this is running for last 1 month in Kanavati Children's Hospital. Those who are from Delhi, they know it's a children's hospital. It's already running. We gave them the software and some hardware. This is running. And the Director General Medical Education, the health of Government of India, they called a meeting, and we are going to upscale it. So this is very much doable. And in UP, our Additional Chief Secretary, they agreed to this. So from the village also, the data was coming directly to. So technology can do wonders. And already Medical Council of India has given us permission to do telemedicine. Earlier the Bombay High Court, stopped it. So we were not doing telemedicine. So with the limited thing, some riders are there, because until you examine a patient, you cannot, and rightfully you cannot diagnose, you cannot write a medicine. This is correct. So some riders are there, telemedicine is available, tools are available, electronic stethoscope has been developed by us, very simple. It costs only 20,000 rupees. And patient sitting in Bombay, you can listen to the heart rate, the heart sounds, to the ball sound, to the respiratory sounds here, sitting here, you can advise. So things are, that's why I'm referring to, the one should not be very wary of the technology. Is simple, doable, can be done, and can be very easily learned. So this is what I'm saying, that technology actually has made a tremendous impact as far as the upscaling of the healthcare system is concerned. And I'd like to share with you the government of Uttar Pradesh and the dynamic leadership of Yogi ji, the Sanjay Gandhi Postgraduate Institute of Medical Sciences have given the task, and 6 districts have been attached with the SGPGI, and they are constantly monitoring the district hospital with the help of this technology. So this is possible that the people sitting at the premier institutions, they can do the hand-holding at the district level, and the things can be done.
I would just like to add here one small thing, because my state card is Nagaland, which is too far from here. And Fortis Hospital in Gurgaon, and Mr. Abhishek Bhattacharya, he can vouch for it. My chief minister wanted medical treatment of a person living in the remotest area. So as a pilot project, the team was constituted by the Fortis Hospital. They beamed everything straight to that person, and the medical superintendent of that area, he was there. He was examining the patient, and everything was, all the data on that person, all the vital statistics were immediately sent to the person sitting in Gurgaon. And he was advising, he was giving the counseling, and his life was saved. So this is a big thing, and this is only possible through technology.
Yes, sir. There are various miracles and beautiful solutions that the technology is enabling us with, and of course, strengthening the healthcare sector. We have another input coming in.
Yeah, when I started about the technology, it is not about the computers or the telecommunications or anything. So probably here nearly 200 people are there. And how many of the people know about the mechanical thrombectomy, or probably apart from the neurologist? So how many people knew about it? So hardly 2 or 3. So we have like from the 2016 the mechanical thrombectomy is there, and stroke is the most disabling thing. And the people are like, there are 2 types of strokes. One is like a large vessel stroke, and another one is a small vessel stroke. In 1996, what we have is the small vessel stroke. Like we got the medicine for that, and still India is boasting about that 1996 achievement of IV tencapsulation or IV alteplase. But in 2016, we got the mechanical thrombectomy. That means we'll go through the groin or through the wrist, and we go into the brain blood vessel, and we will remove the blood clot, what is causing that. Okay, so that the person will become normal. I want to give the awareness. So here almost like all the people are more educated, and but nobody knows about the mechanical thrombectomy. Even people should aware about this, because stroke is the most disabling disease, and people can get better treatment, which was not there previously. And from 2016 onwards, like very few hospitals are doing, even in metros, like even in Delhi or in any other big place. So people should know that there is a treatment for the stroke. If it is a big vessel disease, if you go on time to the hospital, like within 4.5 hours, you will get the injection. Like stroke means, first of all, it is not a heart attack, it is a brain attack. Okay, I want to clarify on that. And the second thing is, if you go within 24 hours, based on your blood supply and how much brain is alive, based on that, you will be revived. And it is no more a disabling disease. Previously, once we got the stroke, that means almost like 30 to 40% will die, and 30 to 40% will be bedridden. Only 30% will go on roads. And now almost like 60% of the people go onto the roads with the newer treatments. So here I mentioned about the technology. I'll take only 30 seconds. So technology means we have the cath labs everywhere. So the cath labs everywhere, but the people using this cath lab, that is the only thing we use. The technology is there from 1990s. But we use the same cath lab, and we will go into the brain and remove the clot.
So I think there are more awareness drives need to be conducted for people to know more about these latest developments and to harness them completely.
This is the biggest game changer, but the people, the awareness into the public is very less.
So there is a gap, but I'm sure that it is getting bridged via these conversations starting up at such portals, and definitely more and more awareness drives are going to come in the sector to improve the knowledge about the latest developments and how people can harness the maximum out of these. So now I would like to open the floor for a couple of questions. We have only very limited time, so let's just limit that to 1 or 2 questions here. So if you have a question, please raise your hand, and you may ask it to our eminent panel here. Do we have any questions coming up from the audiences? All right, so I think there are no more questions. With this, our chief guests for the day are arriving, and we are expecting a couple of more chief guests to come in and join us. With this, I would like to, take a final word from each one of you, starting with you, Dr. Rajesh, on the current state of healthcare. What is the gap? How are you bridging it? How do you see the current situation, and what is your projection for, let's say, in the next 10 years? Where are we going to stand?
Yeah, even before the COVID pandemic, our healthcare infrastructure is not that good, definitely. There is a lot to do regarding the infrastructure, regarding the specialist who needs to treat the various treatments and all. Government has to definitely focus on that. And down the lane, next 10 years, we need to invest a lot in many sectors of the health field, not only the infrastructure, but also the specialist and even the medicines also.
All right.
Thank you.
So we'll quickly take a word from each one of you about how do we see the situation now and, how do we see it in 10 years from now? What are the predictions?
Most important thing what I feel is we should educate the people about the healthcare. Most of the people do not know where to get treated, what disease, where to approach the doctor, at what condition we can approach the doctor, which is the grievous signs of a disease. This is the most important what I feel, because infrastructure we can develop and we are also developing it. But most important is that education of the people is very much important at every step, so that he can get it treated at the proper place by a proper person. Thank you.
I think one of the important for the policy makers for the health, that we have to increase the funding for the health, either for the government as well and the private sector. So the government, the planners has to decide how much the government will spend for the as a whole and how much private sector will participate. If private sector has to come in a major way, then how many percentage of people are insured for the to avail the private sector, and how many is the government schemes are going to help them to get the private sector. The government scheme in many of the states as well as the center are often seen as non-viable for a private sector, and that is more detrimental. So that the private sector is feeling the government is pressurizing them to get the service out of private sector without giving an adequate financial support. If the private sector don't survive, then the government, the balance becomes that the burden on the government sector, that they have to improve their own service. So that is one of the challenges in there.
Prevention is always better than cure, but at the same time, public health is very, 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 very important, that everyone should, mainly the media should boost about the recent advancements, and especially, I am here just to tell about the stroke. So, stroke is more disabling, and most people doesn't know that they can revive back into their life within 1 hour of the procedure. And so the mechanical thrombectomy, whoever came here should spread the word so that the people will know that there is a treatment for that, and people can become normal within minutes after the procedure. Like, it's not for 100%, but 60% of the people can go onto the roads within minutes.
In conclusion, I'd just like to emphasize on the use of telemedicine and digital tools for improving access to healthcare for all. I feel that the more quickly we are able to adapt to it, because smartphone has reached all of every household, and every hand has a smartphone in their bit under their thumbs, and using that, the cost of healthcare can also be controlled, and also timely treatment and timely diagnosis can be done through these technologies. The patient can get the right advice at the right time. Thank you.
The most important thing is that government effort is always successful when people are cooperating. People must cooperate. For a successful completion of any drive. And I always say, हम सुरक्षित तो आप सुरक्षित और आप सुरक्षित तो हम सुरक्षित. So if I am safe, then you are safe, and you are safe, then I am safe. So always it is important that one must follow the protocols, the COVID guidelines, and see to it that those who are violating these protocols should be advised, properly advised, follow the protocols, follow the rules, and we will be able to control this pandemic. Delhi has done a pretty good job. Now we have no deaths. So it's a big thing. So it's the people's participation in any program. Their cooperation is always effective. Thank you very much.
I want to add on rural health. Actually, of the population, 65% is living in rural area, but whereas 70% of the healthcare is in urban area. You can see lots of divide. Wherein definitely technology is going to play a major role. For example, tele-ECG, tele-radiology and all. Actually, we are having a pilot project with our hospital. Around 25 ECG machines have been distributed to the rural clinic where they can use. So within a few seconds, we can give the inference so that we can save a lot many life. Similarly, teleradiology. So definitely future is going to be artificial intelligence related healthcare technology. And also I want to add one more thing. Doctor told about mechanical lumpectomy. So likewise in cardiology, now valve replacement. So I think clinicians will accept that how much pain one has to go for valve replacement. Now the procedure called TAVI, it is a wonderful technology. So likewise, future will be always artificial intelligence based technology. I think the rural and urban divide can be reduced well with the technology.
Final word, sir.
If I take your question was that how do you see yourself the healthcare 10 years from now? Coming to that question, if you look at the health, it has got many spectra. Curative health, promotive health, preventive health, rehabilitative health, palliative health. But unfortunately, our focus is always on curative health, which is visible, politically correct. You know, you are giving something, you are giving medicine, you are giving a diagnostic test, looks good. But in real sense, it's actually the preventive health and promotive health. These two are very important things. So probably government has to now think on to invest more in preventive health and promotive health. One. The second is, if you look at the situation in our country, if you did the National Family Health Survey 5, which has come on a few days back, this is showing two very encouraging things. One is that the total fertility rate has come down. So the number of children per woman is 1.9. So which is a very, very, we won't tell less than 2, which is a very, very encouraging sign for our country. The second thing is that we are no more a young country because the NHS 4 data says 35% population was less than 15. Now it's 26.5. So probably we are now aging more and young people are coming down. And it's true when the population comes down. So keeping this 10 years from ahead, what will happen? So more of the old people like me will be there. You see? So we have to look actually into, from this perspective, what actually is needed to be done. We have to invest more in children. Even today, in our country, 50% children, even in a state like Gujarat, which is a very advanced stage, and so is in UP, 50% children are stunted. That means they are not having full nutrition, correct nutrition, both in the womb and outside the womb. See? And the low birth weight babies are being born more in many states of our country. And low birth weight babies is actually going to make ultimately the pool of metabolic diseases like diabetes, like hypertension. So we have to do something to, so therefore, if you look at why this is happening, an early marriage, poor health of the adolescents, anemic, 70% women are anemic in our country. And lactating women and pregnant women are around 80%. So probably we have to invest there so that the number of, healthy babies are born more and we are actually able to look after. So probably the dynamic has to change, the paradigm shift has to come in our system. Rather than investing more in curative health, probably has to do more on the preventive health, and we'll be able to do it. We could do it. We could reduce the total fertility rate in our country in spite of all taboos, in spite of the unmet need of contraceptive in our country. It still hovers around 50%, but still we could decrease it. So I think this is possible to take care of, and the future looks good. That's what I think. Thank you so much.
So the future looks good. We need to do more investments into the preventive healthcare facilities, and of course the awareness drives need to be conducted more and more. And like Sir mentioned, that the rural part of our population has a more stronger immunity and are more equipped to deal with the diseases. So that information also needs to be, and what they're eating, how they're eating, and what are the how is their immunity level higher than the others, and what the urban people can adapt and learn from there. So there should be two-way learning from the urban to the rural and from the rural to the urban, so that we all are well equipped to handle with such health crisis in future if it has to happen. With this note, I would like to thank all of my eminent panelists here on stage for sharing their knowledge with us, for sharing their wonderful thoughts with us this evening. And I would like to thank each one of you here. Thank you very much, gentlemen, for being on the panel.